I'm going to go through and do different settings. So this was, like I said, the TENS setting. And then we can go to, there's 16 different modes for a TENS effect, or a pain modulation effect. So if I go over here to another one, let's see if it feels any different than just tapping. Okay, is that still just tapping?
It feels a little sharper.
Okay, a little bit of a sharper sensation. Now if I go to a different one, I'm going to go to the third box for the TENS setting. How does that feel in comparison to the other two?
I can't really feel it.
Can't feel it much? Okay, that's fine. I'm going to increase the intensity.
Yeah, it's just like continuous.
Okay, so it's just a buzz.
Yeah.
It's constant. Okay. So now the last box or selection of modes for TENS. Can you feel anything there?
Yeah.
Yep, I see that muscle. Okay. So as you see, you can get different sensations with the different modes, and that's the purpose of the different modes. You find a mode or a sensation that you're comfortable with that helps control your pain, and like I said, they give you 16 different modes to choose from, so there's a lot of selection. If one doesn't work, keep trying to a different one until you get to one that feels comfortable. And now if we go to the EMS, or a muscle stimulation one, I'll stick with this arm again. All right, so you see you're getting some constant. Now, what does that feel like in comparison?
It feels like I can't really feel the shock. I can just feel.
Okay, so the other ones you could feel kind of a shocking sensation where there's a 10. This is just making your muscles work, but it's completely comfortable.
Yeah, that's fine.
Okay, so and that's it. Again, it has 30 different intensity levels, and this is on intensity 4. So if I go to 5, there's 6. And basically, it's going to do exactly what it says, just get more intense. Okay, so I'm going to turn that down and go to a different mode in the muscle stimulating unit. So now this is getting a little more, a faster frequency of the stimulation. So it's more of a vibration, and now it's going to start bringing his arm up. And that's going to be constant. So I'm going to bring it back down. So again, different mode in the same box for EMS, it will give you a different effect. And now we'll go to the last one of massage. Okay. All right, so the settings I had on before was for EMS, it was grabbing the muscle and squeezing it and holding it. This one seems like it's grabbing the muscle and then releasing, grabbing the muscle and then releasing. Kind of like doing stroking or effleurage or milking the muscle. Okay, so when I would use the 10 settings, again, it would be for pain to help control that. The EMS would be to help a muscle that may be atrophied or weak, to try to reinstitute some firing of those muscle fibers. And then the massage I would use for maybe to help increase blood circulation. You can also use the massage, I've used that to help reduce edema or swelling. That helps, like I said, with the milking sensation. You can put it on the edematous extremity and have it in the air. And that kind of, instead of, say for instance, your ankle is swollen from an ankle sprain, you put it on there. I'll often tell my patients to do ankle pumps, but if you have this on there, it'll do it for you. Okay, so you don't have to constantly being pumping your ankle or your calf, and that'll help get the edema out of there. So various options. 24 options for modes and a lot of different reasons or purposes to use this. So there you have it. I think it's a great unit, and I would use this. And I've used it also on myself when I have low back pain or whatever, and I need to go work on my patients, and I don't want to take any pills. And so I have this on my back. I have it going constantly, so it helps control the pain, and I can move about pain-free.